Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to our frequently asked questions section. Today we will talk about getting a cold after surgery. Well, unfortunately, this happens every once in a while where we have a patient that is recovering from weight loss surgery, from a gastric sleeve, and they contact our office, they contact me telling me, well, they got a cold. What can they take? What can they do? What medications are safe to take? Which ones aren't? And that's what I'm here to do today, here to help you out. So, yes, it is, well, it's a bad coincidence to getting a cold, getting the flu after any surgery, recovering from it. And even more if you had an abdominal surgery where you're coughing, where you're sneezing, well, it's a little uncomfortable. Good thing is that the procedure that we do is completely laparoscopic. That means it's tiny incisions, so the uncomfortable sensation, it's pretty much, it's very bearable. So what can you take? Let's start with what can't you take, all right? It is very important that if you're searching for something over the counter, pretty much you can take anything over the counter for a flu, like NyQuil, like anything that is over the counter for cold, but make sure you're not taking an anti-inflammatory. That belongs to the NSAIDs family, N-S-A-I-D, all right, non-steroidal anti-inflammatory drugs. And we have a video, and I'll link it here on YouTube for you to watch if you haven't seen it. So these medications, you gotta be very careful once you had weight loss procedure, gastric bypass, gastric sleeve, because these medications are very aggressive to the inner layer of the stomach and if you abuse from them, you will put a hole in your stomach. But this is not just patients that have had a gastric sleeve or a gastric bypass. If you abuse of these medications with or without gastric surgery, with or without weight loss surgery, you will put a hole in your stomach. So you gotta be very careful on these medications. If you had a sleeve or you haven't, anyone can get a hole in your stomach, all right? So be very aware on NSAIDs because these medications are very aggressive to your stomach. Now, doesn't mean you can't take them. You got to be taking them under supervised medical supervision here. So other than that, can I take Theraflu teas? Yes. Can I have over-the-counter medication like Zyrtec D, like for allergies? Yes. Pretty much, they're all pretty much safe. Just make sure you're not taking an NSAID medication that will risk your sleeve or your bypass or your integrity, all right? Now, if you do have any questions, the best way is to reach out to your surgeon. My patients have my direct email, of course. Reach out to your surgeon and ask him, you know what, I'm feeling like this. That's the way we get it, you know. Patients have our email. I feel a cold coming, or I have a cold already. Can I take this, or this, or this is what I have available at Walgreens or CVS or my local pharmacy. Can I take this, or this? Yeah. And even if you have a doubt or you have question or you're questioning a certain medication, you want to be on the safe side. The way we do it is we know the medication may be a bit aggressive to the stomach. We want to protect the stomach. We place that patient on omeprazole twice a day for the duration of that treatment, and that way we protect the sleeve. All right, so I hope you find this information useful. I hope you recover from the cold, and if you have any questions, always reach out to your doctor. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.